So hello friends, this is a patient of transaxillary drilling of frontal nasal process of macula for difficult frontal sinus where nasofrontal beak is very thick and frontal sinus was very difficult to approach, and also the patient was having high IgE levels with aspirin sensitivity. So in this sort of patients where you have heavy mucosal disease and onto it anatomy of the frontal sinus is difficult, which is covered with nasofrontal beak. So transaxillary drilling of nasofrontal beak is a very useful technique, along with the placement of naso stent, that is a mometasone stent. So it gives a long-standing relief to the patient. So here, we are using a curved burr and we are taking away the nasofrontal beak. So this very difficult nasofrontal beak was there. So we took almost 5 to 6 mm or even more than that of a nasofrontal beak. Because once we take the nasofrontal beak, so there is a direct access on right side to the frontal sash. And now you see with the 0 degree only, we are able to reach the frontal sinus and then remove the disease from inside the frontal sinus. This all is with the 0 degree. Now coming to the opposite side, so again the same problem was in the left side. So here we used transaxillary burr. It is a curved 40 degree burr. So we just took the disease from the nasofrontal beak and then remove the nasofrontal beak. So once we had the adjacent area, so where frontal boundaries are well established, anterior nasofrontal beak has been drained, posteriorly skull base has been delineated, laterally lamina has been exposed, and then medially your middle tegment has been exposed. And then with the curved debrider, we are able to go inside the frontal sinus and then remove the disease from the frontal sinus. And once we remove the disease from the frontal sinus, and then we make sure that everything is fine and we have a nice opening into the frontal sinus. And after that, we have little bit of more drilling so that we can place the mometasone stents here. So these are cell drug eluting stents which are there for quite a long time, at least for a couple of weeks, and they keep on releasing the drug in the frontal. So this is inside the frontal sinus on the left side. So here we ejected, and this is on the right side. So with the 70 degree scope, so we are right into the frontal sinus, and then we place the stent here, and these stents will keep on releasing medications and keep this area pretty patent, and also keep patient disease free for quite a number of time.